Hi, guys. This is Grant. I'm the editor for this podcast. I just wanted to issue a content warning for this episode, not because of anything we're going to talk about to do with health stuff, but because Dr. B does talk very explicitly about being a Florida Gators fan. So if that bothers you, just feel free to hop off. Jokes aside, enjoy the episode. Is Becky a Florida fan too?
She has to.
What was she
No,
prior?
she was. She's from Georgia,
Oh, so she was
but
Georgia
she
fan,
never
didn't really care.
she never really cared.
Yeah, that's fair.
Yeah. She never grew up in a home. It was just two. It was just girls. Her dad really didn't care much. So
There you go.
yeah, out of that,
Worked out for you, because if she was a Georgia fan,
Oh.
it would be a divided household.
it would be a 90-10 split for sure.
Oh man.
Welcome back to another episode of the Real Health Podcast. Thanks for joining us on the last episode of the month where we're going to talk through August being Kids Month. So we're going to share some statistics and kind of talk through some childhood epidemic disorders and what you guys can kind of be processing heading forward. It's more of just unpacking a few things that have been on my heart this week. So we'll dive into that. Before we do, of course, the great Mr. Grant wanted me to talk about what letters on my shirt, why my shirt looks the way it does. It has an F on it, and it's a big, nice orange F with a blue undertone shirt. And so, yeah, go Gators, because it's football season, and we're back. Gators, it feels like, what do they say in Vol Country? It feels like it's 98 again. Is that the only time you guys won a national championship? I don't know. I haven't been paying attention, but I know it's been a long time since then. Well, we are excited that it is fall season, and I love wearing some Gator stuff into the office so you guys can heckle me, make fun of me, but you can't make too much fun because we have beaten you like 16 out of the last 17 years. So we kind of do own you a little bit. If you've shut me off, or if you haven't shut me off, well done. Good job. That means you are full of grace and mercy, and I appreciate that. Please do not make fun of me when Florida loses to Miami this weekend. All right, let's dive in. Football is over. Let's talk through. Gosh, I've been bombarded with this podcast this week of Casey and Callie Means. So this was a Tucker Carlson podcast. We will send a link in the show notes. Or put it on our Instagram so you can go to it, because I think it's a great. I listened to it. I think it's a fantastic umbrella overview of our current state of American health. So Dr. Casey Means was a Stanford graduate. She was 9 years in head and neck rotations surgery, and 9 years in a fellowship program, head and neck surgeon. Graduate of Stanford, and then she just said, "I'm done. Walked away from medicine." She couldn't keep cutting on people that had chronic disease and not being able to communicate to them to stop whatever it was they were doing and change their ways. So she was fed up with the medical system. Her brother, I think he was Harvard trained, MBA, worked with big pharma, lobbying, and really got to discover the reality that you are everything that we have in this country. The food that that's marketed to us, the drugs that are marketed to us, is just lobbying-based, big pharma, big agriculture, and the truth behind it all. It's just so heavy. So I've been in this field. Really, I've been looking into this for like 20 years. So I've been in it for a couple decades. A lot of you, this is new. So when someone's like, "Hey, I want you to listen to this podcast, it's amazing," most of the time I won't listen to it because I've already heard it. I've said it. I've been in it. I've been in it for a long time. What I love is people are waking up to the reality of our current healthcare system. People are waking up to our current state of health. They see it, they believe it, they understand it, and now they know what it's coming from. I think one of the greatest things that has happened is COVID. I think it's one of the greatest things that's happened to a lot of people. Why? Because it forced a line. It caused people to either stay on one side of the line or the other. And to me, it's actually been a blessing because people were able to see for the first time. So they're marketing a vaccine. They're incentivizing a shot. If something is so good, if something is so right, so necessary, so healing, you should not have to incentivize it. That is truth no matter what field it's in. You don't have to incentivize something of high value. People will ask for it, they'll beg for it. So think about that. Like COVID was a perfect prime example of incentivizing a vaccine. When you see it, you're like, hey, that doesn't make sense. Why would I get a free donut if I get a vaccine? Or why would I get a free hamburger if I got a vaccine? Or why would I get whatever it was to get this shot? It just raised questions. And then those questions raised additional questions. And most of you went down a rabbit hole. And for a lot of you woke up, if that's the term we use now. You were awakened to the reality of Big Pharma, which is the kingpin of our country, the one that runs the country. The president doesn't run the country. The vice president does not run the country. The military does not run the country. Big Pharma runs the country. The money from Big Pharma runs this country. Big agriculture. And when you trace the dollar signs and you find out where the money's going, you realize, hey, everyone's being bought. Everyone's being bought in Washington. Everything is being bought. Marketing, TV, commercials, all of that is to incentivize you to buy their stuff. So COVID was a blessing. And so really the podcast that Tucker Carlson had this the brother sister on was just to communicate their current state of American health. And it is atrocious when you look at us as an American culture compared to other developed countries. So the American country as a whole compared to other developed nations, where do we rank? And these are things I tell my patients all the time. Where do we rank? If we just look at what you think American healthcare is so good, so right, so awesome, so amazing, it's not. It's so far from amazing and awesome and incredible. Our healthcare system is absolutely atrocious. It is broke, and it is just a bunch of people making a ton of money. When you assess the rates of like obesity, for instance, guys, it's not cool. 75% of Americans are overweight or obese. That should alarm you. So 3 out of 4 people listening to this, probably less on this podcast because you're probably someone who's healthy and looking for healthy information. But 3 out of 4 people in your life, 3 out of 4 people in America are overweight or obese. That's a staggering statistic, especially when you get into children. And, obviously this month we've been talking about children. And we look at Japan as being, I wrote it down, what is it, 3%, I think is overweight in Japan, 3%. And then here in the U.S., 50% of teens are overweight or obese. 50%, 1 out of 2 teenagers are either overweight or obese. That is a staggering statistic. We are type 2 diabetic. We have overweight, what is all of this? Cardiovascular disease already showing up in kids. What is this? We're talking about chronic preventable disorders and diseases. So the podcast is great. I encourage you to listen to it because if you want a true hour and 45-minute explanation of the ins and outs of just kind of an umbrella view of multiple components of our healthcare system and our financial system, a little bit of insurance, big pharma, big agriculture, food industry as a whole, I think it's worth listening to. It'll really help you. But going back to what I was just mentioning, when we look at childhood issues today, the biggest thing we have to realize is the habits that we teach our kids today will form habits in the future. The kids will reap what is sown today. So not to brag on our family by any means. It is nothing I think necessarily nothing of any big significance of what we've done. It's just who we are. It's how we live. But I'm just gonna brag on my son though. So he's 13. He's in 8th grade, and because of an injury, we got him into training more consistently in the gym. So he during the summer he trained 3 days a week. And he did a lot of strength training and agility training, speed training, whatever. But anyway, he 13 years old, 8th grade, saw some improvements in the gym in terms of like how many push-ups and pull-ups and all these things that he was doing. And it was really cool because now we're having the conversation of not just doing push-ups and pull-ups, but hey, buddy, how do you fuel that? Well, we fuel it with protein. Great. So now he's prioritizing protein. Every meal, snacks are protein-based. So now he's consuming protein. And so what we're realizing, man, it's just feeding into these other areas. So school started, and he could make every excuse to not train anymore, not work out anymore. He's 8th grade, he's 13 years old, goes to school early, gets out of school and then goes to soccer practice and studies and all that stuff, right? So can make every excuse. But he decided this school year he's going to wake up every Tuesday, Thursday morning early, train before school, and then mom will come pick him up on the way to at our West Knox location at the gym, and then take him to school after. He's been doing it. It's been amazing. And so when we started this journey, he could do about 10 strict push-ups, like really high-quality push-ups. Yesterday, he retested, and he was able to do 31 unbroken push-ups. And you should just see the confidence on his face, and he was so excited. And he was talking about the win that he had, and he was talking about how many strict pull-ups he was able to do. And he knows his exact numbers on his bench press. He can do X amount of pounds for X amount of reps. He's like, Dad, I can't wait to do 100 pounds for 10 reps or whatever his goal was. And so now it's like supercharging every other area of his life. And then what we realize, guys, is the small habits that you are building into your children, instilling into your children today, are creating a snowball effect, where that snowball starts really small, and years from now will become really big, mountainous, and be very difficult to budge. So I just want to encourage you. When we look at our society today with children, and we realize 50% of teens are overweight or obese, we realize ADHD, guys, is incredibly high. The rate of kids on Ritalin, the rate of kids on Adderall, the rate of kids who are autistic today, from 1 in 10,000 in the 80s to like 1 in 30 in some areas of the United States, 1 in 20 in some areas of the United States. We're talking about like 1 in 4 children are going to be on the autistic spectrum. That is a problem. We didn't become better diagnosticians, and we didn't change the standards of how we diagnose. So this is a public health emergency. This is a public health crisis that we're looking at in our country today. And so I just want to encourage you, if you're listening to this, and you're probably in 2 camps. The first camp is you have been eating clean, training your children, doing the right thing, going against the grain, maybe not vaccinating, not medicating, getting your kids adjusted, putting them to bed on time, getting them into sports and movement and music, and exploring like who is God and how are you created and how do you add value to people around you. You are one of the very few in this country today. And I just want to encourage you, keep up the good work. We need families like you. We need families like you, because the reality is our infertility rates are so high in this country that sooner or later we will literally not even be able to have children in a couple generations. So kudos to you. Keep up the good work. So proud to have a tribe of families that are fighting for health. You have to fight for your health. It's not going to be easy. Yes, you have to Yes, you have to sign non-vaccine forms. Okay. Yes, you have to have conversations about why you're not vaccinating, or why you're not medicating, or why you're not eating the cupcake at the party. I get it. Yes, it's not convenient. It's not easy, but good job, because kids are diabetic, overweight, obese, and addicted. They're addicted. So well done. Proud of you. You may also be in this other camp where it's like, hey, I'm just starting to explore. Like, this is new to me. Someone just turned me on to your podcast, or I just started learning about like health-related topics. Hey, great job. Way to start somewhere. And maybe you're like, where do I even start, right? You listen to that Tucker Carlson podcast, hour and 45 minutes, you're like, wow, that's overwhelming, great information, but where do I start? Start with food, start with movement, start with chiropractic care. Those are the big 3. Food, movement, chiropractic care. get kids off devices, get them moving. Get kids off of sugar and processed foods and processed oils, and get them to consume whole foods. And get your family under routine chiropractic care. Something we tell families this is like our behind the scenes mission statement. Families in my office, families in this office, okay, are healthier than families outside of this office. We know this to be true. Families under our care are healthier than families not under our care. Why? Because we support you in the mission to fight for your health, to be an advocate for you, to fight with you. So, hey, if you are like, where do I start? This is new. Nutrition, movement, chiropractic care. Hey, maybe this is like so new that you haven't made any changes and you're just learning and you're processing and your eyes are just starting to become open. Hey, good job. Way to be willing to look beyond what you've been trained, taught, and really what you've been incentivized to believe. We have been, all of us in this country have been brainwashed. It's one of the few countries that you can market big pharma, big agriculture to kids, okay, to adults on TV. But that's what's happening. We are being brainwashed every day. We look at electronics, TV, phones, whatever, about what we should eat, how we should act, what we should consume, and what we should ask our doctors for medication. Well done for opening your eyes and hearing a different thought. So we're looking forward the rest of this year, and we're planning out some topics of discussion. All right, so we break it up monthly. We have these discussions of, hey, what do we want to talk about? How do we add value to people's life? So we pray. Our desire was, I pray August was good for you. That you found a lot of value in the conversations that we had in terms of learning about children and their body's needs and supplements and food and having my wife on the episode. Everyone loved that. So I pray this past month was super valuable for you. Thank you for listening. We value you. Heading forward, as we look to September, October, November, December, closing out the year, we would love to know how we can add value to your life. Would you comment on a podcast? Would you comment on a Instagram post or even direct message us? And what do you want to learn about? What do you want to know? How can we help you in your journey? We value, if this has been good, if this has been helpful, share it with someone. Pass it along. But we want to let you know that we're here for you. Let us know how we can serve you. And again, thanks again, as always, for listening to another episode of the Real Health Podcast.